Hey guys, Dr. Hetland here, Gonstead Chiropractor.
Jeff Meland, sports performance coach.
Today we're going to go over plantar fasciitis. We're going to touch on how do you diagnose this properly. Jeff's going to go over the top 3 things you can do at home to self-treat this thing, even buy some tools, inexpensive tools off Amazon. And I'm going to touch on the 3 things I do as a doctor to treat plantar fasciitis when these self-care treatments aren't working.
Right.
Lastly, I'm going to touch on why sometimes we might need to take an x-ray if all these things don't end up working. All right guys, so let's get right in. Before we do, just make sure you subscribe if you like our videos. We're going to be going over a lot more biomechanic videos, so make sure you subscribe to our channel.
We're going to go over the top 3 symptoms of self-diagnosing plantar fasciitis. And the first thing people see is just they got foot pain. Between your heel and the forefoot. Just having that sort of pain is going to hone it in here.
Early when you rise in the morning and your feet first hit the floor, those feet might be screaming. And what a lot of people find out is by the time they take the 20 steps to the bathroom or whatever it is, that pain starts to kind of alleviate. But inevitably, by the end of the day, that foot pain returns and is more often than not worse than it was even when they first got up.
Third thing I would say is finally you get down to it and you've got pain right at the bottom of the heel. I'm going to take my shoe off so you can see this thing. And you're going to get right down to the bottom of the heel. You can kind of push around here like this. But as soon as you get right to where that fascia hits the bone, boom, right there, it's going to send you sky high because it's going to be so painful. If someone's going to get a cortisone shot for this thing because of the inflammation, it's going to be right down at that spot.
All right, guys, so as you know, if you've struggled with plantar fasciitis, it can be an excruciatingly frustrating symptoms that you're dealing with. And so what I want to give you is the tools to do some at-home treatments that you can do at your house, at your gym, or whatever it is with some affordable tools and techniques. We'll go ahead and we'll link some of the tools in the description of the video so that you can find them yourself. We're going to go through a handful of different variations that you can do, and we'll get you feeling right in no time. One of my favorite and my first priority treatments is with a percussion tool, massage tool. And you can spend a lot of money or you can spend a little money. This is a Hypervolt. This is a couple $100. It has a variety of different speeds that allow for release of that tissue. Here's a jigsaw that I transitioned into a percussion gun for about $20, right? A lot more scary. I did file the teeth off the saw blade, but it can be an intimidating tool. A lot of physical therapists will prescribe you rolling on a golf ball and standing on it and pressing into it, but that can be super excruciating and it's hard to do at an intensity that actually gets the desired outcome when you're doing it to yourself. And that's what these tools alleviate. It's fired up, and all I do is I start right at that insertion that Dr. Hetland was talking about, right above the heel. And I'm just going to comb it up and down on the middle, on the inside, and on the outside of that foot. And I would do this for probably up to a minute, a couple times a day. And I would do it right away in the morning for sure. I would do it right before bed for sure. And if you're going to get a workout in, I would do it pre-workout as well. In the comments, we can include a link to a knockoff version of this that isn't necessarily building it yourself, just a cheaper version of this that'll get the job done at home. That we're going to implement is the voodoo wrap. You guys know I love this stuff. I'm just going to demonstrate wrapping my own foot, since we know a lot of you guys will be at home wrapping your own foot. You might not have someone like Dr. Hetland or something to help you out. You're limited by your hamstring flexibility right out of the gate, so maybe bend your knee. But I start right below the ball of the foot, and I start overlapping. And usually I overlap about half. On the foot, I overlap about 3/4. And I'm kind of leaning a little bit. I'm pulling the slack out, and I'm going.
And Jeff, you mean 3/4 overlapping like right here? So
yeah, just like this, yep.
So you're really overlapping.
Yeah, oh yeah.
Real condensed.
Boom. And then I get here, and I go down around the back of the heel, and around the ankle, around the heel, and around the ankle. And then I work my way up around the calves as a finisher, and then I just tuck the tail in, trying to spare my limited leg hair. Boom. What a self-wrap looks like. All right, so now that we got the foot wrapped, I'm going to show you a couple of the movements that we want to do under compression to start alleviating these symptoms. And because we have so much wrap around the arch of the foot, it's created like a little ball so my foot can rock back and forth. So what I'll do is I'll rock up onto the toes, letting my arch kind of collapse into that band, and I rock back, and I drive in, and I rock back, and I drive in, and I rock back. And after I do about 10, 15 of those, I'm going to go and grab the ground with my toes as if I'm trying to scrunch up a towel under my foot. So I grab the floor and relax. Grab the floor and relax. And at this point, I'm really feeling the pressure. I do about 10, 15 of those as well. And the last thing you do is rock on a lacrosse ball. So I take that lacrosse ball, I drive it in to the arch of the foot, and I lean into it. And this time, I use the table to show how someone would help themselves balance. I obviously don't need it because I have tremendous balance. If you have symptoms and you're using this, it's going to hurt bad. Right. But it's okay because it's worth it. Golf ball or tennis ball would work good. Golf ball is a little smaller in diameter, so it's going to be more intense. The reason I like the lacrosse ball is because although it is firm, firmer than a tennis ball, being rubber and bigger in surface area, I feel like it's easier for people to actually do it and do it well.
What the hell are you talking about?
You finish that, my foot's about to fall off. Before you just get up and sprint or lay on your back or something, you want to give your foot the opportunity to get blood flow back to it. Kind of walk around and let that blood slowly start returning to the foot. All right, so this next method, I still call it an at-home method. It involves a foam roller and a kettlebell, so it's not super accessible. But after this would be the ideal setup. If you don't have this, though, we'll show you another method where you can do it on your own without these tools. I like to do one leg at a time because I can get more pressure on it. So what we're going to do is we're going to focus on putting pressure on the Achilles and the muscles going up into the calf, because if we can start releasing these and causing a little bit of laxity, it's not going to pull as much on the fascia through the middle of the foot, which is hopefully going to give us that mobility to absorb those impacts and not have that sharp shooting death pain that it is. So I heave this thing up there. Yep, just kidding, it's light for me. Yeah, I like a more static roll. So what I'll do is I'll roll and then he'll kind of give me feedback about like, oh yeah, that's the spot. And then we'll set it there. And we'll let that weight force itself into the muscle and force the muscle to relax. And this is another one where like a minute, twice a day is an awesome protocol.
And the weight of it is good. You don't have to push. Right?
That's why I like the kettlebell. When you use the rolling pin or something else, you're going to have to put that pressure in. And it's a lot more inconsistent, and you're relying on someone you trust to inflict a lot of pain on you. So that's why I like the weight of a kettlebell.
The only thing to be careful on are blood vessels. So just, starting light. If you have a series of kettlebells, you can use a lighter one.
Yep.
Work your way up to the heavier.
No question. All right, so the last thing I'm going to show you guys is a lacrosse ball rollout. This is kind of what I was telling you, a substitute to the essentially crushing with the kettlebell. You take the lacrosse ball and do the same method. You kind of start on the Achilles and you start leaning into it and you find that sweet spot. And when you find the spot that's screaming, you can just sit on it up and down. And if you need more pressure, you can always stack your feet and lean into that ball a little bit. But it's another way to be able to put a lot of weight into that muscle and start releasing that tension that resides above the area that's affected in the arch of the foot.
All right, guys. So once you've kind of exhausted the self-treatment route, it's plantar fasciitis, got a proper diagnosis. Here's the top 3 things as a doctor I'll do to treat plantar fasciitis. The number one thing that helps plantar fasciitis in my office is called active release technique, ART for short. Usually within 1 to 3 treatments, even if plantar fasciitis is chronic, it can be resolved. So what we're going to do here on Jeff's foot, the plantar fasciitis goes from the heel to the forefoot here. 3 different kind of branches go off of here. But where you're going to get most of this plantar fasciitis pain is right towards the heel, more than likely. We're going to shrink the muscle this way, hold on tissue, and we're going to extend the toes all the way out. So we'll shrink those tissues here, and we'll stretch those tissues out. You feeling that, Jeff?
Oh, yeah.
All right. we're going to go down the whole length of the fascia, just like that. And we're going to try to crunch those toes. We're going to try to release that and even extend the toes as much as possible. Usually it's on the outside part, and then we'll go down the medial part as well onto that foot and do the same thing, breaking that up like that. The other way we'll do it here with the active release, we'll point the toes here and we'll get down towards the heel. We'll hold on, and I'm going to have Jeff dorsiflex his foot as I put the pressure on there. Okay, go ahead, Jeff. You feeling that?
Oh yeah, that's screaming.
Screaming. So we're going to go right on there, release that, and we're going to try to promote blood flow into that area and break up the adhesions in his foot so it can become more pliable and it can absorb the shock. All right, second thing that we do in the office here is the class 4 laser. And what that's going to do is put energy in the form of a cold laser right into that area to promote blood flow and healing. Pro athletes use cold laser all the time to improve speed of recovery, speed of healing. And this is my second go-to for plantar fasciitis. And we'll just go along the heel, and we'll go up along the entire plantar fascia, just like that. Usually do one treatment. Usually 1 to 3 treatments we'll start to see results with this. Lastly, but not leastly, my go-to is the chiropractic adjustment. We're going to target the talus, make sure the ankle mobility is there. That's one thing that starts to lack when you have plantar fasciitis, this lack of mobility of the ankle. And so I'm going to go ahead and give Jeff's ankle an adjustment. We'll see if this wants to release here.
Yeah.
There we got her. And then check the calcaneus here. There we go. So we're going to make sure that the calcaneus, which that plantar fascia attaches onto, is mobile. So the plantar fascia goes right onto the forefoot, so we're going to make sure the toes are adjusted really well.
Cracking the knuckles, baby.
Jeff's got these webbed toes, so it really assists in the adjustment there. The last thing regarding the chiropractic care that we'll do in the office is this is directly related to the ankle and the foot. The nerves that supply your whole lower leg down into your tibialis anterior, down into your plantar fascia, is your L4, L5, and S1 nerves of your back. Depending on your age and depending on what might be going on, we will absolutely be checking this part of your spine to make sure that there's no nerve pressure creating weaknesses that relate to the plantar fasciitis. Hey guys, it was a pleasure doing this video for you. It really is something we enjoy doing. We like to do treatments for specific things that are super common that you guys are dealing with. Comment of the video, let us know what you're thinking. We had one request for quadricep tendonitis. Make sure to comment in the video so we know what you're thinking and we can do more videos for you.